All right, last lesson here in our Pharm course, talking about controlled meds. It's a pretty quick one. The deal here is that there's a great deal of risk to the paramedic student, to the preceptor, to the paramedic program when we've got students handling controlled meds. And so we need to be very intentional, very specific about how these are to be handled, and we needed to put something out about that. And then it kind of added to it at the end to kind of give you an example of what's in the narc box at a lot of places. So controlled medications are not just narcotics. They are locked in a lock box. And so there should be two locks. There should be a seal on the outside, which is usually a padlock or a combination lock of some kind. And then inside that cabinet, there should be medications contained in a box or some other container that is sealed. So we have double lock, double seal. And so, medic students really have no business knowing the combination to the narc box. Now, a lot of times, medic students are doing field internship time where they work. So they know how to get in the narc box because they work there. Not because they're paramedic students, but because they work there. So, in general, if you don't work there, you don't need to know how to get into the narcs and into the lockbox, and your preceptors don't need you to know that. The preceptor can take care of access for the student. So, we got right patient, right dose, right route, right time, right. Got that. But in this case, we need to make sure, because these medications are potent, and we don't want any medication errors, period. And we definitely don't want medication errors in this controlled medication environment. So we need to talk about the route that we're going to go, the rate, the right dose, and then so a real quick review of these medications, of the medication that's about to be given, just in time, right at the time of administration or before the time of administration is what we're looking for. And so let's get that. The student should be rattling that stuff off to the preceptor, ideally. And we just need to go over that real quick. Then how much volume we're going to give, we got to be real sure that we know what that's going to be, because what's going to happen is the student's going to give the volume, the amount of medication, going to give it and give that rest of it back to the preceptor. The students are only going to be holding and handling the controlled meds while they're agreeing on how much to give, giving it, and then the rest of it goes back to the preceptor. It doesn't get laid on the bench seat. It doesn't get stuck in somebody's pocket. It doesn't get laid down by the patient. It goes right back to the preceptor. Period. End of story. Anything else you're doing is not okay. If you're in the ER, you're supposed to be precepted, which means your preceptor is right there while you're giving medications. And while I wasn't born yesterday, and I'm not totally naive to the fact that perhaps that doesn't happen sometimes, maybe for good reasons, but as far as I'm concerned, no, there's not a good reason. The preceptor should be there when you're given the medicines. But if you're going to violate that rule, don't you dare ever violate it for controlled meds. It's too much risk. And this is fair warning. So, too much risk. A preceptor must be immediately available right next to you, watching you when you're handling and giving controlled meds. That's it. There's no more to talk about. Now, while it would be good for you to know what the different records and the official record and the charting and the documenting the wasting of controlled meds and all this, that's great. That's a great learning experience. But your name shouldn't appear on there. That ought to be handled by staff from the facility. And so we don't need students being involved in the documentation other than to kind of see what it looks like. But it's different at every place you go. And so you might as well, just lower your risk there. So anyway, that's my sermon on how we are to act as paramedic students around controlled meds. Very little wiggle room here. But then we wanted to add quickly here at the end, hey, what's in the narc box? Because it's kind of mysterious. You never get to see inside of it. And so here's what's in the narc box. There's a little bit of midazolam. I don't know what concentration it's going to be, and it depends. These are the two concentrations that we've seen most frequently, 5 milligrams per cc or 1 milligram per cc. Some of them come in the Carpujects where you have to screw on the little Carpuject adapter syringe deal that we'll play with in class. Others come in multi-dose vials. It changes sometimes. It changes with the same service, and it certainly changes between services. Fentanyl is the new favorite out there for pain control. We're big fentanyl fans here, and typically we're talking about 50 mics per cc, which is kind of cool because your starting dose is probably 50 mics. It might be 100 in really big people, and so that works out kind of nicely. I don't think it's in the ampules as often as it is in a multi-dose vial or a syringe these days, but again, you just really aren't sure what you got until you get in there. The ideal controlled meds box in my mind would be clear so you can see the content, see that they're there, that they're intact, and see what the packaging is. And so that might be the only benefit I can see to, as you as a student being involved with truck check, is to get a look inside the NARC cabinet at the NARC box and see what your packaging is in there. That would be kind of cool. But that's only going to be helpful if you've got clear NARC boxes. Morphine, pretty common, been carried for ages. Comes in milligram per cc concentrations usually, so the morphine math is not real hard. Same thing with valium, usually 5 milligram per cc. So those Carpujects on the right there are 10 milligram usually. Again, the math pretty easy, and this is pretty standard stuff in NARC boxes. And then in some places, most recently, they've added ketamine, and I suppose this is the most common concentration. And so I just wanted you to see ketamine as one of the things that's up there. So see, it's not all narcotics, but everybody calls it the NARC box. But either way, it's controlled meds, and controlled meds deserve extra attention because of the legalities and the legal and administrative danger that they pose. Plus, they're very potent, and so we wanted to do a special thing just on controlled meds. So that pretty much wraps up our Pharm course, the online part of our Pharm course. There's a lot of stuff we're going to do in the Pharm lab. We're going to do a lot of medication calculations. We're going to talk about paramedic plumbing so that we can draw things up quickly and give them in a variety of situations. And so it'll be fun. It'll be a lot to learn in the lab area, but very much like the other two, the ECG and the airway and breathing, if you don't have a foundation of this cognitive stuff, then just playing around in the lab doesn't make as much sense to you. So do the pre-work, be ready to go, and thanks for attending the Pharm course.